All right, everyone, before we dive into today's massive update about the $2,000 Trump stimulus that everyone's talking about, I need you to stop scrolling right now because what I'm about to share with you could literally put thousands of dollars directly into your bank account within the next few weeks. I'm talking about confirmed payments that are heading to Social Security recipients, disability beneficiaries, and millions of Americans across the country. Now, I know you've probably seen a lot of clickbait out there, a lot of misinformation, a lot of people promising you money that never seems to materialize, but today I'm cutting through all of that noise to bring you the real facts, the actual updates, and most importantly, exactly what you need to do to make sure you get every single penny that you're entitled to. So do me a favor, hit that subscribe button right now, smash that like button because this information is time sensitive and you're going to want to stay updated on every single development as it happens. Let's get right into it. So here's what's happening right now in February 2025, and trust me, this is where things get really interesting. There has been massive buzz circulating around Washington about a potential $2,000 stimulus payment that could be coming under discussions related to Trump administration proposals and congressional negotiations. Now, I want to be completely transparent with you because that's what I always do on this channel. When we talk about confirmed versus proposed versus speculation, there are some very real discussions happening at the highest levels of government about getting significant financial relief into the hands of American families, especially those on fixed incomes like Social Security and disability. Let me break down exactly what we know as of this February 10th update. First and foremost, there are ongoing conversations in Congress about economic relief packages that would specifically target vulnerable populations. We're talking about our seniors who have worked their entire lives and are now living on Social Security. We're talking about individuals on disability who are struggling to make ends meet with rising costs of everything from groceries to medications to utilities. These are the people who need help the most. And finally, there seems to be some real momentum building to actually get them that help. Now, the $2,000 figure didn't just come out of nowhere. This amount has been discussed in various proposals over the past few years, and it's gained traction because economists and policy analysts have determined that this is roughly the amount needed to provide meaningful relief that would actually make a difference in people's lives. Think about it. $2,000 could cover several months of groceries for many families. It could pay off outstanding medical bills. It could catch someone up on their rent or mortgage if they've fallen behind. It could provide a much-needed cushion for emergencies. This isn't just pocket change we're talking about. This is life-changing money for millions of Americans. So who exactly would be eligible for these payments if they move forward as currently discussed? This is the critical question that everyone wants answered. Based on the proposals that are gaining the most traction right now, the primary beneficiaries would include Social Security retirement recipients, Social Security disability insurance beneficiaries, supplemental security income recipients, veterans receiving VA benefits, and potentially other federal benefit recipients. Now, some proposals also include income thresholds, similar to what we saw with previous stimulus payments, where individuals making under certain amounts would receive the full payment, with the amount phasing out at higher income levels. Here's what makes this particularly significant for Social Security and disability recipients. These are individuals who typically live on fixed incomes that haven't kept pace with inflation. Even though there was a cost of living adjustment for 2025, many seniors and disabled individuals are finding that their increased benefits are immediately eaten up by higher costs for essential goods and services. The grocery store prices haven't gone down. Prescription medication costs continue to climb. Housing costs remain stubbornly high. Utility bills keep increasing. So even with a COLA increase, many people on Social Security and disability are actually worse off than they were before because their expenses have increased faster than their benefits. This is why targeted stimulus payments make so much sense from a policy perspective. These aren't just handouts. These are investments in the well-being of Americans who have contributed to our society, who have paid into these systems, and who deserve to live with dignity and financial security. When we put money directly into the hands of people who need it most, that money gets spent immediately in local economies. It goes to grocery stores, pharmacies, utility companies, and landlords. It circulates through communities and helps everyone, not just the recipients. Now let's talk about the timeline because I know that's what everyone really wants to know. When could these payments actually hit your bank account? Based on the current legislative calendar and how these things typically work in Washington, if a relief package were to be passed in the coming weeks, we could potentially see payments going out as early as late February or March. The IRS and Social Security Administration have the infrastructure in place from previous stimulus rounds to distribute payments relatively quickly once authorization is granted. For those who receive their Social Security or disability benefits via direct deposit, you would likely receive any stimulus payment the same way, which is the fastest method. For those who receive paper checks, the timeline would be a bit longer, but the agencies have gotten much better at processing these mass distributions efficiently. What I want to emphasize here, and this is really important, is that you should not have to do anything proactive to receive these payments if you're already receiving Social Security or disability benefits. The government already has all of your information. They know where to send your money. You don't need to fill out applications, you don't need to call anyone, and you definitely don't need to pay anyone to help you get your money. I'm saying this because, unfortunately, every time there's talk of stimulus payments, scammers come out of the woodwork trying to take advantage of vulnerable people. If anyone contacts you asking for personal information or money in order to get your stimulus payment, that is a scam. Hang up the phone, delete the email, and report it to the authorities. Let me also address some of the political dynamics at play here because understanding the landscape helps explain why these payments are being discussed now. There's bipartisan recognition that seniors and disabled Americans are struggling. While Democrats and Republicans may disagree on many issues, there's actually significant common ground when it comes to providing relief to these specific populations. The challenge, as always, is in the details. How do you pay for it? What's the total cost? Should it be a one-time payment or ongoing support? These are the questions being debated right now in congressional committees and in negotiations between the administration and legislative leaders. Some proposals tie the stimulus payments to broader economic recovery packages. Others propose funding them through different mechanisms. There are discussions about making them part of budget reconciliation, which would allow passage with a simple majority rather than requiring 60 votes in the Senate. The political mechanics matter because they determine what's actually achievable versus what's just aspirational. What I can tell you is that there's real energy behind this right now in a way that we haven't seen in quite some time. For those of you who are on Social Security retirement, I want you to understand how this would work in conjunction with your regular benefits. This would be a separate one-time payment on top of your monthly Social Security check. Your regular benefits would continue exactly as they are. This wouldn't reduce your future benefits or affect your eligibility for anything. It's additional support, not a replacement for anything you're currently receiving. The same goes for disability beneficiaries. Your SSDI or SSI payments would continue normally, and this stimulus would be supplemental to those benefits. Now, I've been getting a lot of questions from viewers about whether this would affect other benefits or programs. This is a really smart question to ask. Based on how previous stimulus payments were structured, these payments were not counted as income for purposes of determining eligibility for other federal benefit programs. That means it wouldn't affect your eligibility for things like SNAP benefits, Medicaid, housing assistance, or other programs. However, if you receive means-tested benefits, you should be aware that if you save the stimulus money rather than spending it, it could potentially count as a resource depending on your state's rules and the specific program. This is something to be mindful of. And if you have questions about your specific situation, it's worth consulting with a benefits counselor. For veterans who are watching this, there's good news for you too. Many of the proposals being discussed include VA benefit recipients in the eligible population. If you're receiving disability compensation or pension from the VA, you would likely be included in any stimulus distribution to Social Security and disability recipients. Veterans have sacrificed so much for our country, and ensuring that those who are living on VA benefits have the financial support they need is absolutely a priority in these discussions. I also want to talk about what you can do to prepare and to stay informed as this situation develops. First, make sure your direct deposit information is up to date with the Social Security Administration or whichever agency pays your benefits. If you've recently changed banks or closed an account, you need to update that information immediately. You can do this through your My Social Security account online or by calling the Social Security Administration directly. Second, be extremely wary of scams and misinformation. Only trust official government sources for information about stimulus payments. That means SSA.gov, IRS.gov, and official announcements from federal agencies. Third, keep watching this channel because I will be updating you the moment there are any new developments. When legislation is introduced, when votes are scheduled, when payments are authorized, you'll hear about it here with all the details you need to know. Let me also address the elephant in the room, which is that not everything you hear about stimulus payments will come to fruition. Politics is complicated, and proposals don't always become reality. I never want to get your hopes up about something that's uncertain. What I can tell you is that the discussions happening right now are more serious and more advanced than many of the rumors that have circulated over the past couple of years. There are real legislators putting forward real proposals with real funding mechanisms. Whether it ultimately passes and in what form is something we'll have to watch closely, but the momentum is there in a way that's genuinely encouraging. For those of you who are struggling right now, I want you to know that there are resources available even while we wait for any potential stimulus payments. Many states have their own assistance programs for seniors and disabled individuals. There are utility assistance programs, food banks, prescription assistance programs, and other resources that can help bridge the gap. Don't suffer in silence. Reach out to your local area agency on aging or disability services organization to learn about what's available in your community. These organizations exist to help you, and they have staff who can connect you with resources you might not even know exist. Looking at the bigger picture, this potential stimulus payment is part of a larger conversation about how we support vulnerable Americans in an economy that's left too many people behind. The cost of living has increased dramatically, but benefits haven't kept pace for many people. Healthcare costs continue to be a major burden, especially for seniors and disabled individuals who often have significant medical needs. Housing affordability is a crisis in many parts of the country. These are systemic issues that require long-term solutions, but in the meantime, direct payments like this proposed $2,000 stimulus can provide immediate relief that makes a real difference in people's lives. As we wrap up today's update, I want you to remember a few key takeaways. First, there are serious discussions happening about a significant stimulus payment for Social Security and disability recipients. Second, while nothing is final until it's signed into law, the momentum behind this is real and substantial. Third, you don't need to do anything proactive to receive payments. If you're already getting benefits, the government has your information. Fourth, stay alert for scams and only trust official government sources. And fifth, keep watching this channel because I will keep you updated every step of the way as this develops. I really appreciate you being here today and staying informed about this critical issue. This is the kind of news that can change lives, and I'm honored to be able to bring you these updates and help you understand what's happening in Washington that directly affects your wallet and your well-being. If this video was helpful to you, please hit that like button, subscribe to the channel, and turn on notifications so you don't miss any future updates. Share this with your friends and family members who might benefit from this information, especially other seniors and disabled individuals who need to know what's coming. Drop a comment below and let me know what you think about these potential stimulus payments and how $2,000 would help you and your family. I love reading your comments and hearing your stories, and it helps me know what kind of content is most valuable to you. Until next time, stay informed, stay hopeful, and I'll see you in the next video with more updates on your money and your benefits. Take care, everyone.